Health literacy is the ability to make good health decisions every day. Are you prepared? Find out next on City Corner. I'm Steve Potter, and welcome to City Corner. Health Literacy Missouri is a not-for-profit that works to help you make good health decisions. And I'd like to welcome our guest right now. To my immediate right is Dr. Catina O'Leary. She's the president and CEO of Health Literacy Missouri. Next to her, Sam Pettyjohn, and also here, Pam Kelly, who are staff members of that organization. Welcome to the program, all of you.
Thank you.
Thanks for having us.
And a little late congratulations, Catina, because this position for you is a fairly recent one.
That's correct. I started about a year ago, so I've been with Health Literacy Missouri since June of 2012, and it was a pretty significant change for me. I moved from Washington University, where I was a researcher for a bunch of years.
Psychologist by trade.
No,
Psychiatrist,
social worker.
I mean.
Social worker in the Department of Psychiatry.
Oh, there we go. I was
Yeah.
close. Sam and Pam, briefly just talk about what part you play in this organization, Sam.
Sure. I've been with the organization since the very beginning, and I've worked initially as working on the communications team, and then have moved on to become the health literacy program manager. So anytime we do any sort of health literacy intervention or any sort of training around the state, I kind of go in and oversee those projects.
I see. Pam?
And I came to Health Literacy Missouri in August of last year, so I just celebrated a little over a year anniversary as well. And my role at Health Literacy Missouri is really to just work on forming strong partnerships and working on initiatives.
And when you say partnerships, I guess that kind of is a big umbrella, right?
It's huge.
Don't you work with like medical professionals, organizations, groups?
Right. We work with healthcare organizations, providers, advocates across the state. So our office is here in St. Louis, but we really serve people across the state.
And the whole point is to make people understand that the decisions they make about their health are very important, and make sure they're informed to make the right decisions, obviously. I'm guessing that a lot of people maybe feel overwhelmed when they start hearing about this topic or discussing it, because I'm just guessing that most of us don't feel that we're real informed about this. I'm one of them. I like to feel like I'm really in control of my life. But when it comes to issues about health and making decisions, I don't know what I'm doing. Is that typical?
It's absolutely typical. I think it's interesting that people feel pretty universally scared of the healthcare system. So no matter how educated you are, if you're a physician that's had lots of training, when it's your own healthcare, that's a little bit of a scary situation. So when you find for the first time that you're sick or you need care or treatment, people feel uncomfortable. The nice thing about health literacy, though, is we work really hard to make it clear to people that everybody feels that way. We want to really normalize that experience and then help people understand strategies to feel better and really feel empowered to do what they need to do in the system.
Sam and Pam, could you comment on that?
Sure. We built a very complex healthcare system. I work in hospitals fairly regularly. I get lost every time that I go to a new hospital. But
I get lost in the parking lot.
That's me. I get lost in the parking lot. I'm perfect for this job, right? Because I'm constantly lost in healthcare environments. But just think about how complicated it is to get finding a doctor initially, whether that be using a website, using a phone tree, like where you call in, they make you push 1, push 2, push 3. There are a lot of barriers that healthcare professionals might not think about. And so our real mission is to go in and help them identify those barriers and really make it so that patients can more easily navigate through their system and get the care they need in a shame-free and a stress-free way.
Pam, what's your take on the complexity of it all?
Well, you know, having worked at a very large healthcare system, I could certainly understand some of those complexities. And just to sort of bounce off of what both Catina and Sam have said, I think the biggest takeaway is really just to empower patients to feel as though they can actually have a voice in their health care and be able to take the information from their provider and use it in a way that's actionable so they can improve.
And I don't know if you want to break it down these kind of categories, but is it tougher for maybe people in lower economic classes? Are things more complicated for them because maybe they don't have the resources that more affluent people have, that kind of thing?
You know, In social work, we talk a lot about kind of compounding vulnerabilities. So every time you have one more complication, one more vulnerable situation, things get more complex for you. So people who have lesser amounts of education, people who are maybe in rural areas versus urban areas, people who don't have as many experiences with insurance or the healthcare system. Every time you add one more of those things, people become more confused and it becomes more complicated. I think that's a particular issue now when so many people are going to get health insurance for the first time ever.
Well, let's talk about that without,
big deal.
Let's talk about that without
Right.
going into it too much.
Right.
Because we don't want to be political.
No.
And, you know, geez, I don't understand any of it. I thought I was halfway smart, but it's so complicated what's going on with healthcare.
Right.
That's right. People are going to have access to care, access to insurance, which will then hopefully grant them access to care. A lot of people for the first time. And so, as I said earlier, you know how confusing it is when you have to find a new doctor, but you have some experience doing that already. So a lot of these people are going to be entering the primary care system and not have any real prior experience navigating. So imagine the complexities they're going to be facing.
Well, and just, you know, from what I've been reading, you know, recently, just the problems I've had people, like when they make the phone call or go online to try to get into it, just the roadblocks, just technical things, I guess, for some of it, that, you know, obstacles, and, you know, are people going to give up?
I don't think people are going to give up. There are a bunch of folks out there ready to help them. So here in Missouri, we have money from the government, but also from the Missouri Foundation for Health to fund navigators who are sitting in healthcare organizations ready to help people use the system. And, you know, there were glitches. There were really significant glitches. But there are these people who are trusted in the communities who are there, who are going to keep saying, well, let's just do it again. Let me do it with you. Let me help you. Let's work through this. And I think it's going to be okay. And, you know, the government had been saying all along, October 1 was the start date. Everybody doesn't need to call on October 1, right?
That was part of the problem.
And that's what happened. People were really excited, and they all picked up the phone and they called, or they all got on their computer and they tried to do it right away. And so we just need to kind of back out and get people to slowly enter the system.
I think I heard, like, I may be making these numbers up, but the original system was set up so they could talk to 50,000 people at once, and, like, I think the demand was like 8 times that or
Right.
something.
There were 8.6 million unique views, unique attempts to access the website just in the first week. So.
Did you have something, Pam?
Well, just listening to this, and you know, the other problem with the access was that then there were those of us who really wanted to get on and just see what the system was like and how to navigate it so that we can then go back and tell our different prospective organizations, which compounded the problem too.
I had a policy professional tell me actually that he felt somewhat responsible for some of the slowdowns because he tried to log on 30, 40 times just to be able to see what the marketplace looked like that first week.
Well, and a good thing to remember is if you have health care now through your employer, nothing's going to change for you. Right? Because I know people that have health insurance and they're worried about it, and I keep telling them it's not affecting you. It's for people that don't have health care up to now.
Right. If anything, they have more options now. They're able to keep their insurance through their employer, but they're also able to navigate the exchange just like any other person would and compare with what they're paying from their employers as well.
I'd like to talk a little bit about the history of your organization. Before we do that, though, you recently moved to a new location downtown.
We did. We moved. So we moved from the Central West End, which was a founding location, to a downtown office building.
We've got a couple of shots of, I think, the exterior. So what are your new digs like?
You know, we've got a great office building. It's pretty standard. It's, you know, on the 6th floor of an office building that's pretty well filled with other great people who are doing important work. We're right there in the middle of the urban core, so we can walk out and connect with people who are partners.
I was going to ask you, because being down in Washington, I mean, it's a high visibility spot. So is being in a high visibility spot important for you?
So we were in a high visibility spot as well. We were on Euclid in the Central West End in a storefront. And so people could kind of walk in and interact with us very closely. A lot of the business that we do is a little more private than business that you would want people walking in all the time. So it's nice to be in an office building where we can kind of control access. And that's pretty nice. But we're close enough to the street and close enough to people that we can walk out and see people right away. So Washington Avenue is fantastic for that.
In fact, just yesterday we did a training for St. Louis Public Schools, and we were able to walk to the meeting location right there on, I think it was on 8th. And it was just an amazing experience. Usually we have to load the car and drive, and really it's made me feel a lot more connected to working with the public organizations in St. Louis.
And there are a lot more lunch places downtown now, right?
Well, that's always nice.
That's a plus. You have to think about that. Well, let's talk briefly, if we could, about the history of your organization, Health Literacy Missouri. It's only about, I guess, 3 or 4 years old. And how did it come about? What's the history?
Well, I can speak to that. Originally, there was this idea that was kind of coming out from some federal organizations and was identified by a Missouri Foundation for Health as something they really wanted to investigate. And that was this idea of health literacy, people's ability to use and understand health information in a way they can actually have it be actionable in their lives. So they started what was called the Coordinating Council. And it was a group of professionals that were interested in taking on this task of health literacy. And they were housed in different universities, Mizzou, Washington University, St. Louis University. I might be missing one. But and the idea was from that, they would kind of build an action plan. And from that action plan, it was decided to actually create a nonprofit organization that could go out and do this work with healthcare professionals, with community-based organizations. And now here we are, this kind of freestanding organization that's able to go in and work with anybody that is what we would say patient-facing, anybody that's going to work with anybody in the population that needs help in these areas, whether it be professional or just as patients.
I'll just play doctor's advocate. I'll play devil's advocate. That was a slip of the tongue. Devil's advocate. You'd think that doctors would be in tune with this issue to begin with, and that'd sort of be their job to begin with, to make sure that we understand these things. And I know that's probably not realistic. Pam?
No, it's not. And it's actually not a class that's really being taught in medical schools. I think when you really look at the human factors in medicine and how doctors can relate to their patients, that's a gap that's missing. And so I think in today's medical curriculum, they are recognizing that that's a huge need, and you're seeing it placed there. But no, it's not a given. I think it requires some additional.
And are all medical professionals open to this idea that this is something they need to be more proficient in? Is that an easy sell?
Some organizations identify this as a major issue that they want to take on and really make a priority in their strategic planning to really make sure that they're doing everything they can to be as patient-centered as possible. And good health communication is a big part of being patient-centered. Other organizations, there has been pushback saying that we are the healthcare professionals, we understand what we need to do, we don't need an outside organization working with us. And we're slowly seeing that's kind of eroding. Slowly, people are starting to realize that maybe they aren't the best health communicators, and they can go a long way to being better at being patient-centered in everything they do.
And just to add to that, part of that change, Steve, is the fact of the new health laws that are in place that really require the patient to be a part of that care decision, to be patient-centered.
Right. I guess, and teaching is difficult. Ask any teacher, right? Educating someone is difficult. I guess you need patience to work with patients. You can use that.
Oh, that's good.
we need to take a break. Health literacy is our topic today, and we'll be right back after this. So.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you. Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
I'm Steve Potter, and welcome back to City Corner. Our topic today is a not-for-profit organization, Health Literacy Missouri, and our guests are that organization's president and CEO, Dr. Catina O'Leary. We also have staff members Sam Pettyjohn and Pam Kelly. And to recap, your organization's been around for just a few years in Missouri, and the whole idea is to help educate both patients and medical professionals about how to know more about the health care process and make the best decisions for them as individuals.
That's correct.
That sum it up pretty much?
Right. Our focus really is on there's a lot of training that goes into what we do, a lot of training around communication skills, around designing materials, doing all these things to make the experience more patient-centered specifically.
Well, I don't know if you know the answer to this or not, but is this part of a national movement per se? Are there organizations like this in every state? Is this a growing trend, or is it just new for Missouri, or what can you tell me about that?
So it is a national movement. So there is, the federal government has an Institute of Medicine roundtable focused on health literacy, and they publish pretty significant reports about the state of health literacy in the country and how that impacts healthcare and major significant outcomes for people. There are other state organizations, but every state doesn't have them. And there are a couple of really big national organizations that are, for-profit organizations that do this work as well.
And I'm thinking that, the reasons for people to be informed about making these decisions is obvious for their own health. But I would think maybe in the long run it also saves money and resources.
Absolutely.
Do you think?
Absolutely. One of the big pushes, Sam talked about how our focus was on trainings, but really our focus is on assessing organizations to really sort of diagnose where they may have challenges around implementing clear health communications, both verbally as well as in print materials or websites in all of those different areas. And I think when you talk about the cost, which is in the billions, it is a tool and a service that we provide that's extremely necessary to improve quality as well.
So if you think about one of the main reasons that hospitals have penalties, or maybe patients don't get well as fast as maybe they don't understand all of communication when they're discharged from hospital. While they're in the hospital, maybe their family doesn't understand what they're supposed to do. They go away from that visit and they aren't following the directions. Maybe they don't take the medicine the way that they're supposed to. They don't get a follow-up visit. They don't show up and do things in the way that the physician asked them to. It's not because they don't want to often, it's because they didn't hear it and they didn't understand it.
That's a good point. Maybe it's sort of a mindset we have. I think maybe I'm guilty of this too. If I go see a doctor for whatever reason, I feel like, well, they're in charge of everything and they need to tell me what to do, where I need to be more proactive.
Right. One of the steps that patients can take is just checking to make sure they comprehend what was said. They can engage in this technique called the teach-back technique, where patients can actually say, now, I just want to make sure I understood everything we talked about today, and then attempt to in a sense, teach it back to their provider using their own words.
And it's true, a lot of people don't do that, right? Your doctor tells you something, you don't ask questions, you go home and worry about it.
Right.
Or your wife says, what did the doctor say? And you're like, I don't know.
I don't know.
Yeah.
Hey, we've got a couple of pictures of behind the scenes of your Health Literacy Missouri. Let's look at that, and you can...
No, this is Derek. This is our business manager, Derek, doing some important work on the phone, it looks like. Derek Collins.
Let's go to the next one.
That's just a typical everyday at our office. That's Megan Rooney, our plain language project manager, and that's me dress casually there, but we dress in the everyday apparel.
You didn't know you were going to be on TV that
That's
day,
right,
did you?
that's right. And we have a very collaborative work environment where no project just really goes through one department, where we really try to look at things really holistically around making sure that all aspects of communication pieces are done in a way that are really patient-centered and as easy as possible to understand.
Well, how big a staff do you have?
So there are 10 of us. But before we go away from Megan, I want to just say our plain language team is really important to the work that we do. So Megan's job in particular is very much focused on taking materials in, whether they're the web or print materials, and focusing on how to make them more understandable. So she looks at reading level and things like that everybody understands, but also how things are formatted on the paper, what the pictures look like. Do the pictures relate to the person who's going to receive the materials? The fonts and the formats and the words, everything about that. Does it make sense, and is it useful to a patient? And that's a big part of our work.
When we're defining health literacy, let me just read something. I got this off your website. From the Patient Protection and Affordable Care Act of 2010. Health literacy is defined as the degree to which individuals have the capacity to obtain, communicate, process, and understand the basic health information and services needed to make appropriate health decisions. That's pretty much it in a nutshell. Sure. And here's some facts that I came across that I'd like you to comment on. It's something like 9 out of 10 adults struggle to use health information, right?
That's true.
9 out of 10?
So it breaks down to the fact that the average person reads roughly at a 9th grade reading level. Their ability to read and comprehend information is roughly at a 9th grade reading level. When they go to the doctor, typically the information they receive is whether that be verbal instruction or a print material or a resource they're asked to look at, is typically between a 10th and 12th grade reading level. So there's a gap between what we as healthcare professionals say and the materials we provide, the education we provide, the demonstrations we do, and the average patient's ability to understand it. And that really is where health literacy is. It's that gap between what a patient's able to understand and act upon and what a healthcare professional typically provides in the way of education and training.
And even with that said, even if people with higher degrees struggle with it too.
Sure.
So it's not just because maybe your education, it's not just because you don't have a college degree that it might be confusing to you.
That's very true.
That's a good point, I think.
Yes. So we mentioned earlier that people maybe with lower socioeconomic status might struggle more than others, but what we do also know is that health literacy is a problem across the entire population. Just because you have a PhD, just because you're an accountant, a teacher, a professional person, doesn't mean that when you walk into the doctor you're going to understand all the information you're given. Medical information is very novel. It's like a whole other language. So there's really a chance that you might not be able to understand that information just because you don't have those experiences.
And the point you brought up before too is, doctors are individuals too, so how good are they at, just because they know it doesn't mean they can express it in a great way necessarily, right?
Sure.
Let me just throw out some topics and get your thoughts. Best practices in health literacy, promising best practices in health literacy, what are those?
These are some of the things you've heard Sam talk about a little bit already. Teach Back is a great example. Almost everywhere we go, we make sure that the providers really understand how to use Teach Back and how to promote that with patients. If you think about the limited amount of time that you have in every medical visit, there's so much information in a short period of time. It's very important that you make sure that people walk out the door knowing exactly what you want them to know and what they're supposed to do.
You talk about limited time. It's an hour and a half in the waiting room and 5 minutes with the doctor, right?
That's right.
It seems like that sometimes.
Absolutely.
What's the national action plan to improve health literacy?
Oh, sure. Well, that is a document that was put out, I think jointly, but the CDC was behind a lot of that. And it was this idea that when we identified that health literacy was a major issue that might be contributing to cost and also contributing to bad patient outcomes, they put out a national action plan about ways you could address health literacy kind of at the state level, at the local level, ways you could address health literacy and practices that would hopefully make patients be more informed and make healthcare professionals just better communicators and really practicing being patient-centered. And we've taken that and really turned it into functional services that we can offer to healthcare professionals.
You recently had a conference. Pam, I could start with you. If each of you would maybe just talk a little bit about the conference, maybe the role you played in it or what you took away from it.
Absolutely. So we just celebrated our 4th annual Health Literacy Summit and DOC Award dinner. Dr. Cynthia Bauer was our keynote, as well as our DOC Award winner for this year, but was unable to attend. It was a wonderful conference. It was, the summit was filled with really powerful speakers that talked about innovative health literacy strategies that are happening today. And my role was really to just sort of bring all of our partners together so they can sort of collaborate with each other and brainstorm about how to move health literacy initiatives forward.
Katina?
No, it was a fantastic summit. This was the first time we've hosted the summit in St. Louis. We've typically been in Columbia. So it was a different group of providers, people from the Boot Heel, other parts of the state that maybe found it hard to get all the way to Columbia have been able to make it to St. Louis this year. So we had a big crowd, and there was just a lot of conversation and communication. We had to break up the tables with people, kind of laughing over the dinner and kind of move things along because people had not seen friends and partners in a long time. But we were really accomplished. We had a lot of conversation. New projects are coming from the event. It was exciting.
We've only got a couple of minutes left, and I know there's still so much that we could cover. Let me just throw out a couple of things. Maybe make it clear about health literacy, the role that that plays in really preventing diseases, because that's really the bottom line, isn't it?
It is. And I'll go ahead and chime in. I think when you think about health literacy and preventing preventable diseases, as well as looking at chronic illnesses, they both play a huge role in being able to empower the patient to take control of their health condition or disease state in a way that before wasn't available to them, by giving tools to the provider so that they can interact with their patient in a way that's meaningful.
Let's take a look at a couple more pictures from behind the scenes at Health Literacy Missouri.
That's Christy. She works on our plain language team, so she's probably working to edit a document to make it more readable and accessible to patients out in the field.
Oh boy, there I am. So this is our summit. We were celebrating Dr. Cynthia Bauer from the CDC here. And a couple more members of our staff. So one of our interns, Tori, Derek, who we mentioned earlier, and Ellen.
Finally, in just a few closing seconds, I'll give you all like 10 seconds to answer this question. How do we measure your success?
Lives saved.
Patients reached.
What more is there? Lives saved, patients reached, good care.
Pretty two good answers. And is your website, is that valuable for someone to check out?
I think it's absolutely valuable. You have that website link?
Yeah, we're going to show that in just a minute, but how can people use that?
Well, there's a lot of tools for healthcare professionals that are on there, and there's also some resources. If patients are looking for information, they probably will go to our website and then be pushed to another site where they can learn some more about being more empowered as a patient.
That's Sam Pettyjohn. We've also been talking to Pam Kelly and Dr. Catina O'Leary of Health Literacy Missouri. Thank you for helping to make a complicated topic a little simpler, a little more understandable.
Well, thanks for
And
having
we
us.
hope people take advantage and use the link and check into you and start making better decisions, bottom line. Thank you all so much.
Thank you.
Thank you.
I'm Steve Potter. That's all the time we have for this edition of City Corner. Thanks for watching. Bye.
Coming up